Literally, I love it. 25. Well, you know, I guess
every time you touch it, you get
when I was driving into like
or tell them something they didn't hear right. Well, that's what I started.
yeah, you had no choice. I'm sorry you didn't have changing dynamic. Something happened. I know. You should be in bed. You're like,
oh yeah,
take it next week off. And we all laugh about it, but it wasn't the same sport. He was here at the line. See,
All right, just a couple more minutes. We're covering.
Thank you.
we may all say.
trying to get like a 10-second warning.
It's like they're eating cake.
That'd be great. Corona cake.
This is yours. All of them. I knew you were telling me all of them. I thought they were back frozen. That's why I get very, very colorful. Yeah, it's Rorschach. Well, sort of. You know, some people call it a hobby. I call it that. There it is. There it is. I'm going to maybe one. Don't jump the gun.
It's just me. I'm excited.
Not just you.
Just me.
Vanessa.
They will be up in just a moment.
Are you now? Can you put it in front of your doors? Could be a big cell. Could be the tower.
Well, that's a long countdown of people.
Good evening. I'm Summit County Commissioner Elizabeth Lawrence, and thank you very much for your patience. As we await new information from the state, we apologize for the delays, but thank you for understanding. I would like to introduce our team tonight, who we have here. Summit County Manager Scott Vargo, Director of Public Health for Summit County, Amy Wineland, and Summit County's Environmental Health Manager, Dan Hendershot. They will be speaking to you today and answering questions. As you know, earlier today, Governor Polis announced the very first case of COVID-19 in Colorado, and that was a man who is visiting our community right here in Summit County. We understand there are a lot of concerns and a lot of questions, and I want to let you know that we are here to be supportive and share information. You guys are our neighbors, our coworkers, our friends and relatives, and we will do what it takes to protect Summit County in this and also be a great resource. For people concerned about travel here, that's an individual decision. But let me reassure you that us here, we are going about our normal lives. It's important for us to continue to live, work, and play here in Summit County, and do things as we always do. And we encourage our visitors to keep their trips as planned and recreate in our beautiful Colorado mountains in Summit County. As far as school, I'm continuing to send my daughter to school. She will go tomorrow morning. She would maybe want a free day, but I'm going to send her. And I know many of our other employees are planning to do that as well. When a new virus like COVID-19 emerges on the public health scene, there are many questions, and it is understandable to be concerned. I would like to reiterate that our community members should rely on trusted, credible sources of information to prevent the spread of misinformation. So we thank you, media, for helping us get that message out. Helpful information about limiting your exposure to coronavirus is available on the CDC's website, as well as the state CDPHE website. FEMA guidance for COVID-19 preparedness is available on ready.gov. Also, the Summit County Emergency blog is a great place for up-to-date information on the situation here. We consistently update it as we have new information, and we'll be planning to do that over the coming days. People who have general questions about the coronavirus disease in 2019 can call, coronavirus CO-19, can call Colorado Help at 303-389-1687. or at 1-877-462-2911. Or you can email the Colorado Helpline at cohelp@rmpdc.org. We will make sure to have this contact information provided on our website so that any of our visitors or residents can find this information easily. Again, we will proceed with the evening. Thank you so much for your patience.
Good evening. My name is Amy Wineland, the Public Health Director for Summit County. Summit County Public Health considers any new infectious disease a serious concern and has been diligently monitoring the situation for the past few months and preparing to take precautions should COVID arrive in our community. We've been coordinating guidance with partners in the hospital system, educating healthcare providers and childcare providers about what to look for, and facilitating quick diagnosis of potential cases, educating schools and childcare programs, and reaching out to the public about general best practices to reduce the spread of infectious disease. Disease investigation is a core role of public health agencies. Our Communicable Disease Program conducts 24/7 monitoring of more than 60 reportable diseases, including COVID-19, to help to prevent the spread of disease in our community. We regularly practice and update our emergency operations plans to prepare to respond to a wide range of potential hazards. We routinely work with local, state, and federal partners to respond swiftly to emerging issues, and our work on COVID-19 has been no different. Several individuals in Summit County have so far been tested for COVID-19, and before today, all results were negative. We learned of today's positive test result from CDPHE today at approximately 3 p.m. this afternoon, and we have been working extremely closely with CDPHE to assist the investigation. We received initial details of the case, which the governor shared early this evening. We have begun our contact tracing investigation process, which involves identification of persons who may have come into contact with the infected case and subsequent collection of further information from new identified contacts. Contact tracing includes identifying where the person was while he was here, places he visited, stayed, recreated, ate, and other activities. Once we obtain this deeper level of detailed level of information, we'll be able to try to identify who may have been in contact with him. Transmission is possible after the infected person has begun showing symptoms and when they're in close prolonged contact with the person who has been showing symptoms. This is for 10 minutes or longer. I'd like to share some of the key details of the case that we've learned so far. Colorado has its first case of COVID-19. That was ours today. The case is considered a presumptive positive case because testing was conducted at the state level. The test will be sent to CDC for official confirmation. The state is acting on all presumptive positive cases as if they were confirmed because a quick response is essential to minimize the spread of the virus. The patient is an out-of-state visitor to Summit County, a male in his 30s. He traveled to Italy in mid-February with a colleague. An individual who traveled with him is a known case and positive COVID-19 in another state. Upon returning from Italy, the patient spent time in his home state. He then traveled to Colorado on February 29th via plane. He was asymptomatic when he traveled to Colorado. According to CDC, transmission from asymptomatic people is not thought to be the main way this virus spreads. The governor's office has been in touch with Denver International Airport and has shared the information that we have at this time. The person traveled to Summit County from DIA in a rental vehicle and met with friends, and they stayed in a condo in Summit County. We know that he was here for outdoor recreation and that he skied at Keystone and Vail Mountain Resorts. The governor's office notified Vail Resorts late this afternoon, which oversees both ski resorts the patient visited. On March 3rd, the man developed symptoms and went to St. Anthony's Summit Medical Center in Frisco the following day. On March 4th, in the afternoon, a specimen was taken to the lab for testing because he met criteria.
Can you speak up a little more? We're getting feedback.
Oh,
They can't hear you.
sure. Today, on March 5th, the state lab received a presumptive positive result. For healthcare reasons, this patient was it was recommended that this patient travel to a lower elevation for his health, and the patient was discharged and traveled in a private vehicle to Jefferson County wearing a mask based on guidance given. At this time, the patient is now recovering in isolation in Jefferson County. His close contacts in Colorado have received quarantine instructions, and quarantine order is forthcoming. Public health practitioners are investigating and will attempt to notify anyone else who may have been exposed because of this case if necessary. We also have since learned some preliminary details of Colorado's second case of COVID-19 today, which was also announced earlier this evening. This case is not located in Summit County and is unrelated to the first case. The case is an elderly female Douglas County resident. She returned to Colorado from international travel. She is currently isolated at her home per CDC guidelines. Now I'd like to turn it over to our Environmental Health Manager, Dan Hendershot.
Thanks, Amy. Again, my name is Dan Hendershot, Environmental Health Manager for Summit County Public Health Department. And Summit County, I want to assure you, Summit County is working hard to minimize the number of cases. However, each of you possess the most effective tools for protecting yourselves. This is information that we've been sharing over and over. You've heard this message, but we need to keep hearing this message of how to protect ourselves. So I'll start with stay at home if you have a fever, respiratory symptoms, or believe you are sick. A fever is considered as having a fever over 100.4 degrees Fahrenheit using an oral thermometer without the use of fever or other symptom-reducing medicines. Second, practice routine cleaning of frequently touched surfaces. This includes tables, doorknobs, light switches, handles, desks, toilets, faucets, sinks, laptops, phones, etc. Cleaning has proven to be a very useful tool at preventing any kind of illness, especially believed to prevent this coronavirus. Thirdly, if surfaces are believed to have been contaminated with germs from high-hazard bodily fluids, such as urine, feces, blood, nasal discharge, eye discharge, or tissue discharge, use a disinfectant after cleaning the surface. Always follow label instructions to ensure maximum effectiveness. Fourth, practice good hand hygiene frequently. Wash hands often with soap and water for at least 20 seconds. If soap and water are not readily available, use an alcohol-based hand sanitizer that contains at least 60% alcohol. Next, do not touch your face unless your hands are recently cleaned. This is something we've talked about a little bit. It's very difficult for folks not to touch their face. Average person touches their face 2,000 to 3,000 times a day, or 3 to 5 times a minute. Dirty hands don't make you sick. Touching your face doesn't necessarily make you sick. A combination of those two factors do. So don't touch your face unless your hands are recently cleaned. Promote cough and sneeze etiquette. Cough and sneeze into a tissue that's immediately disposed of if possible. If you don't have one readily available, cough or sneeze into your arm out of the protection of your community if you are sick. Next, get a flu shot. Why get a flu shot? While this is not 100% effective, this season's flu shot has shown better effectiveness than last season and will reduce the risk and severity of the flu. And in the event, as we're experiencing, of a local COVID-19 situation, it can reduce the stress on local health hospital response by reducing the flu cases generally. Next, practice social distancing. They've been shown that limiting your distance by 6 feet or in tight spaces for more than 10 minutes can be effective at preventing the spread of this disease and other diseases. Next, place signs. Consider placing signs up and around your place of business that encourage and remind people to practice these measures against the spread of illness. And finally, if you believe you may have symptoms consistent with COVID-19, please call your medical provider before going to your provider for a physical visit. Thank you.
So I'm Scott Vargo, Summit County Manager. I want to take just a moment to thank all of you for coming and joining us tonight. It's important that we are able to share information with you, and it's equally important for you to be able to share that information within our community, as our goal is to keep the community as safe and healthy as possible, and getting accurate information out there is a big component of that. With that in mind, we want to open up for at least a few questions from folks, of any of the folks that are up here, and we'll do our best to respond to those questions.
Do we know where the person who was infected, do we know where he stayed, where his condo was?
Amy?
So as I said, we're still trying to recreate the timeline of where he went, and this level of detail we are still researching and investigating and aren't able to release that at this time.
There's a lot of people wondering who have reached out to us that said, we have a house in Vail, we have a house in Breckenridge, we don't know if they stayed at that house. Wouldn't it be as simple as asking him, where did you stay?
Yeah, we're still trying to identify exactly where that was at this time, and we will make that available when we can.
Do we know if he had any other interactions with people at Vail or Keystone?
As I said, we're still trying to recreate the timeline of everywhere he went. He indicated to us there weren't many opportunities where he had close contact, close prolonged contact, where we would be concerned that there was a health threat or risk.
So we know in terms of the timeline that, he got to the state on February 29th. Do we have an idea of the days he was specifically at Keystone and Vail?
Again, we're still trying to recreate that timeline. And as we have more details, we'll be able to release that in the next couple days.
Before the test that came back positive, presented positive, did he take another test when he came back to the United States after being in Italy and being in close proximity to someone else who tested positive? Or was this the first test?
This was the first test. The guidance right now that CDC is recommending that we are doing travel monitoring and isolation for those coming back from China and Iran. But right now, those coming back from Italy, South Korea, Japan are getting information, and cruise ships are getting information on what to look for symptoms, and the recommendation is to restrict their movement.
Was St. Anthony's prepared for people that treated him there? Were the proper precautions taken in the hospital?
I can refer you to the hospital for that question, but from what I am aware of, they followed every personal protective precaution that is recommended by the CDC. Yes.
So his two friends that he traveled with, they're in quarantine right now, that's correct?
Yes,
He had contact with some unknown case. How come he wasn't in quarantine?
He wasn't symptomatic at the time. He knew his colleague was testing positive in his home state.
I guess my question is, so now that he's tested positive, the people who are around him are supposed to quarantine, so I'm wondering why that didn't happen when his colleague was tested positive. Does that make sense? Why didn't he quarantine when his colleague was positive?
Yeah. His colleague, he wasn't aware of a positive result with his colleague until many days into his visit here in Summit County.
Okay, thank you.
And I'll add that did contribute to his level of concern and notifying the medical providers of that circumstance as well.
Aside from his two friends and fiance, have any other community members been contacted or notified that they may be in danger? In other words, that they had been in contact with this person?
Again, he indicated that he had no other close proximity, prolonged contact with anybody other than who he arrived here with. Again, we're still trying to track down that timeline, and we will, our investigation is evolving and ongoing, and again, over the next couple days, more details of this investigation will be made available.
Are his two friends Summit County residents?
No, they are Denver residents.
Has anybody else been contacted from your office or from the state saying, hey, you may have been in contact with this guy?
Have we, I'm sorry, could you repeat
Has
that?
anybody else, has anybody, somebody works at Keystone, somebody works at Vail, somebody was skiing, somebody was on their flight. Has anybody been contacted, to your knowledge, that may have been in contact with this person?
Well, we haven't made any of those contacts because we're still trying to dial in the timeline and where he was, and then so we have not been making any of those calls yet. As we find more details, again, this is an evolving investigation, and as we find those details, those people will be contacted if needed. Again, he indicates that he was not in close proximity for any prolonged amount of time with any of the activities that he has done that we know of so far.
So the two of his friends are Denver residents. We're talking about somebody who came out of town with his fiance. So none of them are residents here in Summit County. They had to stay at somebody's condo. Is there a concentrated effort to reach out to whoever owns that condo to make sure that they know that somebody with the coronavirus was staying at their place?
We are awaiting that information right now. So
would it be fair to say that they have not been contacted?
I think, yes, that would be fair to say because we simply do not have the information.
When you say investigators, who is doing the investigating? How many investigators are we talking about? What kind of role are we talking about? Are they your people? Is it you?
Yes, our public health department staff, our staff of public health nurses, we have a lot of skill in investigating all sorts of reportable and communicable disease investigations. We do it, it's part of our role.
Do you at least know where the condo was? It Breck? Was it Keystone? Was it Copper? Where was the condo? What town was the condo in? Do we know that?
We do know that the condo was in Keystone.
Elizabeth, with spring break on the way, and there's going to be a lot.
Sorry, Matt, I just want to clarify one thing. So as far as with the patient, that's CDPHE that's leading that investigation. At this point, I think it's correct to say we have not had contact with the patient to talk to the patient yet.
I'm wondering, you talked about tourism. It took us 15 minutes just to get to the fact that the condo was in Keystone that he stayed at, which seems pretty important. How do you convince the public that you're prioritizing public health over tourism?
Again, it's an evolving situation. As we get the details that we can provide, we will do that in the next coming days. We are still waiting some details about, exactly where this was so that we can contact them and provide the guidance that we need to.
Matt.
With spring break, on its way, there's going to be big waves of people coming here to Summit County. They're going to be seeing that, we're dealing with this as a community as well. What do you tell those people that are looking ahead to their travel plans to come up here? It's safe to say you might feel comfortable letting your daughter go to school, but maybe a family that has their plans booked to come up here for their family vacation for spring break, maybe they don't feel as comfortable with that. What's your messaging to those people right now?
I think that's fair and a great question. I would say at this time that, again, it's an individual decision. We are going off the information we're receiving from the state as far as any precautions that they are sending out. At this time, they haven't done that. We are not under a state of emergency at this time. Neither is the state of Colorado. So at this time, it seems too premature to enter into anything like that.
Just to clarify, you spoke about the tracing process, but then also said CDPHE are investigating. Who's doing that tracing process?
So because this case is now isolating and quarantining in the Denver area, they are taking the lead on the interview questions of the specific case, and then as they do that and we need more information, they're relaying that to us. We will be doing the contact tracing investigation here locally in Summit County, and then Denver, Jeffco and Denver will be doing the contact tracing and investigation with all of the other the folks that are in the Denver area. along with CDPHE's guidance and lead.
So we'll take a couple, we're gonna take just, we're gonna take a couple
You guys
more.
that you don't know where the condo is, and now someone's in that condo renting it. Is there a concern there? Is there a worry there? Would you stay in a condo in Keystone without knowing exactly where this is at?
Again, we're trying as fast as we can to get the information that we need to be able to provide information and details to where this location is so that we can provide that guidance and protect the public.
What state is the man from?
I'll add on to that, California. So Matt, I would say that my priority as an elected right now is to know where that condo is and what the risk might be. And we are depending on experts from the state as well as Dan from our environmental health manager to tell us what those risks might be. So that is a priority. I'm committed to continuing to push on that issue.
When can we get our next update?
We don't have a scheduled time for an update at this point. As soon as we have additional information, we'll provide that, whether we're providing that in written form or an update on our website, or we're doing another formal press briefing. That will be dictated by the information that we do receive. But we'll certainly do our best to keep people updated in real time as best as we can. So I think that's all the time we've got. Thank you very much for coming and taking the time.
Can you say the website?
Sorry?
Website?
Summit County, www.summitcountyco.gov. Thank you all.